When most people hear allergy, they think of sneezing, hives, pollen, or food reactions. But allergy is only one part of hypersensitivity. Hypersensitivity means the immune system reacts too strongly, chooses the wrong target, or causes tissue damage while trying to protect us. The immune system normally protects us from bacteria and viruses. But sometimes it misreads the situation. It may overreact to something harmless, or mistake part of the body for an enemy. Type 1 hypersensitivity is the classic allergy pathway. Allergens such as pollen, foods, or medications trigger IgA and mast cells. Histamine and other mediators can cause sneezing, runny nose, itchy eyes, hives, asthma symptoms, and in severe cases, anaphylaxis. Type 2 happens when antibodies bind to antigens on the surface of our own cells. If red blood cells are targeted, anemia can develop. If platelets are targeted, bruising or bleeding may occur. Some autoimmune blistering skin diseases also fit this pattern. Type 3 occurs when antigen and antibody complexes are not cleared well. They can deposit in blood vessels, joints, kidneys, or skin and trigger inflammation. Examples include lupus, vasculitis, and some forms of nephritis. Type 4 is driven by T cells, not antibodies, and it appears later. Nickel earrings, hair dye, fragrances, cosmetics, or rubber products can cause allergic contact dermatitis 1 or 2 days after exposure. Type 5 is often considered a subtype of type 2. Instead of destroying cells, antibodies change receptor function. In Graves' disease, antibodies stimulate the thyroid, causing palpitations, sweating, and weight loss. Hypersensitivity includes immediate allergy, antibody-mediated cell injury, immune complex disease, delayed T-cell reactions, and receptor dysfunction. That is why hives, asthma, lupus, vasculitis, contact dermatitis, and thyroid autoimmunity can all be connected through this concept.